All right, a few definitions before I get into this. We're going to talk about genetics. Medicine is swinging towards the personalization of treatment, and all of that has to do with the immune system, either increasing your immunity to something or giving you something which changes the organism or the disease that you're trying to treat to make it more susceptible to your own immune system containing it. So we need a few definitions first. Chromosome is up on the board. Chromosome, that's a structure in the nucleus of the cell that contains all the genetic information that you need, that the body needs to know. Human beings have 46 chromosomes. The sperm cell in the male carries 23, and the ovarian egg cell carries 23 as well. Now, the next thing is genome. And genome is a word used to describe the entire genetic information that's encoded in the organism. In humans, there are approximately 3 billion pairs of DNA and 25,000 genes. Now, what's a gene? A gene is a DNA molecule that contains all the information for coding a biological unit of inheritance. It is self-reproducing and is transmitted from the parent to the child. And then finally, what's DNA? DNA, we all know about DNA if we watch the criminal episodes on the TV. DNA is deoxyribonucleic acid in a double helical structure, like a coil. You've seen pictures of that. With RNA, which is ribonucleic acid, and DNA chains. So just keep in mind that the DNA is in the genes are on the chromosomes. We've got 23, we've got 46 chromosomes in each cell. Now, I want to talk about Alzheimer's disease. There's new studies, new things happening in the evaluation and treatment of Alzheimer's disease. Now, I've just described to you about chromosomes and genes and the fact that we have 46 chromosomes altogether, and about that each sperm cell and ovarian cell contains half. And when these halves get together, you have 46. Normal people have 2 sex chromosomes, either X or Y. Females have 2 X's and the males have 1 X and 1 Y. Now, chromosomal abnormalities occur all the time and cause a variety of birth defects, including mental retardation, short stature, cleft palate, many types of congenital heart disease, many brain abnormalities with seizures. You can also have genes that mutate, that change, and these can cause sickle cell anemia in the black population, cystic fibrosis of the lungs, muscular dystrophy, and many, many, many others. I want to talk about Down syndrome. Down syndrome is formally labeled Mongolism because of the physical features of a person with Down syndrome. And that's a chromosomal disorder that's seen in children born to older women, usually over 40. And they have an extra chromosome called trisoma 21. And this results in mental retardation and specific physical abnormalities, short stature, flattened face, alterations in the eyes, the ears are low on the head, and abnormalities of the fingers, and frequently congenital heart defects. Now, in a Down syndrome person, the aging process is accelerated and most of them die between 45 and 50. But they manifest symptoms of Alzheimer's dementia after 40. So a Down syndrome person has a short lifespan. But it's been known for 25 years It's been known for 25 years that they have an extra copy of a precursor protein, which is called APP, myeloid precursor protein, APP. That precursor protein produces myeloid beta, which is A small b. And this is the substance which is thought to cause the amyloid in the plaques and tangles of the brain that we see in Alzheimer's disease. Now, Alzheimer's disease, it cannot be diagnosed clinically. You can suspect it, but you can't prove it. It's diagnosed at autopsy by examining the brain both grossly and microscopically. And what you see in the brain are these amyloid plaques and tangles, and that's how you make the diagnosis. Now, in 1999, back up, you can manipulate experimental animals, particularly mice and other species, to produce substances that cause disease in humans. And there is a strain of mice who develop all of the features grossly and microscopically of Alzheimer's disease. And upon these mice are the experiments that are done to see if you can change the production of this myeloid in the brain by some means before you extend that to human beings. So in 1999, they vaccinated mice and they formed antibodies that prevented the amyloid deposits in the mice brain. That was in 1999. In 2010, they developed a monoclonal anti-myeloid B antibody, which retarded the progression of myeloid buildup in the brain by 15 to 25%. So they started to think about when and how should you treat people with autosomal dominant Alzheimer's disease. The Alzheimer's disease runs in families, and there are genetic changes which you can examine, which makes your chances of developing Alzheimer's disease much greater than the normal population. You can also study amyloid beta in the spinal fluid. And this is, abnormal amounts of this substance have been found as long as 25 years before a patient's symptoms were clinically apparent. So there is a chemical way of examining. You can also check in the blood for this substance. So in the blood and in the spinal fluid, you might be able to say this person is at risk or higher risk than the normal population. This raises the question, how early must you intervene to delay the onset of symptoms? When do you start to treat if you have a treatment? If you wait until Alzheimer's disease reaches the point where it's clinically apparent by talking to a person, by doing a mini mental examination of a person, then it's too late. There is no treatment that you can give which will prevent the progression of Alzheimer's disease once you've made clinical diagnosis, clinical being with your eyes, ears, and hands. Now, if you translate these theories to people with Down syndrome who develop this at 40, then maybe you should begin treatment, if a treatment is available, by the time they're 20. And the authors of these studies raise the question about lifelong control of myeloid beta metabolism in the same way that we treat the control of cholesterol for cardiovascular disease. There are lots of children with hypercholesterolemia, and we treat these children with the same medicines we treat adults because we know that from lifelong studies that their tendency to develop heart attacks and strokes and other vascular problems are very great. So you begin treating them as early as possible to get their cholesterol down. The same thing is true with diabetes. If you know that obesity is the cause of diabetes and obesity runs in the family, then you start treating the obesity right away. You don't wait till the diabetes becomes apparent and then treat it. Now, just last 2 days ago, on Wednesday, there was an article in the North County Times about a new drug for early cognitive impairment. Now, this is the new drug, Batnuzumab. Anytime you see MAB on the end like this, that means they're dickering and fooling around with the immune system, trying to develop a substance that will either prevent or enhance a function that they want to treat. And this drug is like that. Now, we see these situations not just in Alzheimer's disease, but we see these in all kinds of tumors, particularly in breast cancer. And they're treating colon cancer, breast cancer, lots of different kinds of diseases with substances that have names this long that usually end in MAB. And this was in the North County Times. It's put out by Pfizer and Johnson & Johnson. And it says, and I'm quoting, "It is promising if used early, but it was not successful if they started treating people who had already clinical manifestations of dementia." So if we could have a chemical substance that we could identify in the blood or in the spinal fluid or both, and if we could get some neuroimaging techniques that define amyloid, the amount of amyloid beta that's in the brain, then we can, very soon after that, they'll start pinpointing ways of changing that. And that's where we are at the present time. Now, there is a substance, this second one, fluor beta peer F18, which is called Amyvid. And that's put out by Kaiser and Johnson & Johnson working together. And this is a substance which you can use with a PET scan. We talked about PET scans in the past. These are scans where you inject chemicals into the bloodstream, and then these chemicals go to the brain, and they light up the brain in different colors, and they do a MRI of the brain at that time, and they can estimate the density and the amount of amyloid plaques that a person may have. So if you combine the chemical possibilities with the PET scan possibilities, and you make a diagnosis early, then the researchers will have a much better chance of developing a preventive treatment. And if you begin to treat it early, maybe we could be able to prevent some of the disasters that we're seeing every day now. This is very early in the development of these changes, but I think very promising, and something that we'll watch very closely. I'll try to answer your questions, but this is very fancy stuff. Yeah.
What about cost of these and getting those tests done? Have you any idea, or do you think
No, this
is going to pay any of this?
you could think right off the bat, a PET scan costs probably $2,000 to $3,000. Nobody wants them to stick a needle in their spinal canal and do spinal fluid analysis. Everybody would stick their arm out and let them take a sample of blood. So until they get something which is simpler than what we're doing now. But these are all steps that are being taken. It shows that there is progress in the study of these diseases. You first of all have to be able to determine what you're trying to treat, or what causes the problem. Then it's easier to figure out a way, how can we stop that? And then the final thing, of course, is when do you start treatment? You wait until you're sick, or you do it before you're sick.
My husband had Alzheimer's, and his son was very anxious about this because my son
Your son?
at 69.
Yes, well,
He's rather, you know, he's kind of went very fast.
I think your son should be anxious about it, but I can give you an example in my own family. My first wife died of Alzheimer's disease. Her mother died very young and had no chance to develop it. It was Alzheimer's disease in the grandmother. And now her sister is in the throes of that. And so what do you think I'm thinking about my kids?
Well, I'm sure the 2000 he would be happy to pay to find out if he could get the drug
Yeah.
to help
But
him. But that's the thing.
it's not a one-time thing. Suppose you get a PET scan at age 40. It's great. Suppose you get a PET scan. When do you get the next one? 42, 45, 50? And suppose you get one at 50 and it shows something. But I'm saying to you that this is the way things are developed scientifically.
Yeah.
You have to first be able to identify the problem, examine what goes into developing the problem, and then you can develop the treatment.
Are they doing human trials on New Zealand?
Yeah. Yes. Yes.
Because again, can people
And again,
get in
these
touch with advisors and see if there's places that will take people for, even now, where people get in clinical studies?
no, this is still experimental. But even this, anytime you see a word that long, the price goes up. In treating, in treating cancer, some of these treatments are $10,000, $20,000 a treatment. But you know, what do you do? Jack?
Could you say a word about genetic testing? Because I understand there's a test that costs like $100 or $200 that if you have 2 E4 alleles, that's an indicator for Alzheimer's. If you have 1 E3 and an E4, and all of that. What do you know about
I
that?
don't know very much about that, but that's what they're working on. It used to cost $10,000 to have your genetics screened. Now it's down to $1,000 or less. Eventually it'll get down. It gets lower and lower as they get better and better. And also the instrumentation gets better all the time. But we just don't know enough about it. But we're on our way. That's the point. The point is we're not back in the dark ages. We're on our way. And eventually, maybe not in our lifetime, but maybe in our kids' lifetime, they might be able to come up with something that says you can treat this. Jim?
Is there a difference between Alzheimer's disease and dementia?
Yeah, yes, there are. There are several different kinds of dementia. Alzheimer's disease is a specific one of several. But when a person has dementia, it doesn't make a whole lot of difference what the cause was, because the result is about the same in all. But there are several different kinds.
Dementia can come on suddenly, or
No. Well, dementia that comes on suddenly, you'd start thinking right away about a brain tumor or some disease of the brain that you might be able to identify. It's mostly for Alzheimer's. It's mostly very, very, very gradual. And not all people who develop Alzheimer's die of Alzheimer's. It's just another thing a person can have. But it's so prominent and it's so prevalent that anything that you come up with which is new information, I think is worthwhile talking about. Okay? Now, any questions on anything? Ed?
What are the first, if you have Alzheimer, what are the signs?
The sign? The first
I
sign?
heard it was not changing your clothes.
I don't think you're gonna get it, Andrew.
Because you're really,
Edry wants to,
I see it.
Edry wants to know the first signs of Alzheimer's, the first signs. And she mentioned not changing your clothes. That's far down the road, Edry, far down. The first sign is loss of short-term memory. Loss of short-term memory. Yeah, Jim?
Is Alzheimer's genetic?
Yes, Alzheimer's disease apparently runs in family. That doesn't mean to say because you're in the family you're going to get it. Remember, you get two sets of genes, one from mama and one from papa, and they aren't the same. And you may have preponderance of one and preponderance of the, just look at the facial features and the size of the children. And you can see, oh, that one's not a Colleen. That guy's a Nixon. He's of the mother's side. But the others are, I have one son that's 6 foot. Nobody in my family has ever been 6 foot. So he's not a Colleen, he's a Nixon. He's from the mother's side. Looks like him.
The reason I ask, my sister-in-law's mother had dementia or Alzheimer's. My sister-in-law also is developing.
Yeah, that's in the family.
She doesn't know me, or we can't call her anymore. She doesn't know what a phone is. And
She's far down the road.
yeah,
Yeah, well, it is true that it runs in families. And of course, the longer we live, there's also other changes that cause dementia, dementia-like problems that have nothing to do with it. As I said, at this moment, you can't make a diagnosis unless you do an autopsy. But that's changing.
yeah.
It's changing. Okay.
Thank you.
Thank you.